I am Dr. Stephen Smith, and this presentation is on the medical treatment of autism. Is it a myth or a reality? There's a lot of misunderstanding about what the medical treatment of autism really is. To understand this, we first need to understand what is autism. Is it a disease, as we traditionally know it, or is it a description of symptoms or a syndrome? If a disease, what are the treatments? Typically, we treat diseases with drugs or behavioral techniques. Is autism caused by genetics, by toxins, or some undiscovered cause? Well, from the traditional standpoint, we make a diagnosis, autistic child, and we have our treatments, and usually those are drugs. In this slideshow, we are going to present things that are inflamed or not working in the red tones, green for things that are working, and yellows for things that are working, and clear for things that are not doing anything. So these drugs have been tried to treat the brain of autistic child directly, and as a general rule, they have not worked very well. Their side effects and their help have about equaled each other, or in some cases the side effects were worse than the benefit. Is autism an isolated disorder? Does autism occur without comorbidity? Well, first we have to understand what comorbidity is. Comorbidity or comorbid conditions are additional disorders co-occurring with the primary disease or disorder. So let's take an example of that. Diabetes. The causative factors are obesity and genetic factors. You can have a family history of diabetes and not get diabetes, though. If you keep your weight down, your diet good, exercise regularly, probably won't get diabetes. But if you get obese, then you are more likely to get diabetes than someone who does not have genetic factors. And once you have diabetes, there are a bunch of comorbid conditions that usually accompany it. Cardiovascular disease, kidney disease, neuropathy, eye disease, or wound healing. And then there are diseases that are actually caused by the comorbid factors. And in autism, we see a number of these things. We see dysbiosis, poor immune function, impaired methylation, genetic issues, high toxic load. Is this a coincidence or is this a cause? There are other multifactorial diseases. Diabetes is one of them. Obesity mainly and lack of exercise. Cardiovascular disease, obesity, diet, inflammatory diet, inflammation. This is the total load concept used in integrative medicine. If the total load exceeds capacity of the body to handle the load, then you have a disease. And in autism, you also have an inflamed brain. In many other chronic diseases, people just say, I have brain fog, my short-term memory is bad. So you can see these are some of the factors that I've listed here that can contribute to this problem. And they're in red because they're inflamed and they're unhealthy conditions. And so we see a load that's unhealthy, and the body reflects that, and the brain follows. Now, this rarely conditions is usually a mixed bag. So you may have something like bacterial overgrowth, fungal infections, slight decrease in digestive enzymes, moderate chemical load, moderate heavy metal, no parasites, and low glutathione. And you see the total load is portrayed as a lighter shade of red, and the body and the brain also reflect that. Now, this is a healthy state. We have good digestive enzymes here. We have no bacterial overgrowth, no viral infections. We do have chemical and heavy metal load, but it's moderate. And everybody has this because the planet is contaminated. There's no parasites, detoxification's okay, and we have a normal glutathione. Glutathione is a chemical that our body makes that helps clean out toxins and protects us from oxidative stress. So we see a moderate load here, and we have a state of homeostasis. The body is in pretty good shape, and the brain is happy. autism is a spectrum disorder, and we're in the midst of an autism epidemic. The rates have been skyrocketing. It can be mild to severe, and there are almost always aggravating factors. In 20 years, I've not seen a single case of autism where there weren't these comorbid conditions. It can vary in the same individual over time, sometimes in the same day. You might eat a food that triggers something, and you get a flare. There are genetic factors for sure. Some families have 2 or 3 autistic children. But we're having an epidemic, and epidemics are not caused by genetic factors. If you combine genetic factors with environmental factors, which are environmental toxins are increasing in our environment, and our diet is getting worse because of all the contaminants in food, then you have the makings of an epidemic. Except in the Amish. They have much lower rates. But they use organic foods, they don't use pesticides, they don't use all these chemicals in their homes or in their cars. They don't have electrical smog, they don't get vaccinated. They have a very low total load. So here's this in a portrayal in a sort of a cartoon fashion or a diagram showing a healthy child. No parasites. This green area is the gut. You see it's green. That generally means it's in a state of health. Healthy flora, good digestive enzymes that can break down the food. Maybe a little bacterial overgrowth. That's not completely white. No food allergies. So we got a big green area go to in this kid. Nutrition is okay. Vitamins, there's some bacteria. There's not too much there. They're healthy bacteria. Maybe a little virus load. Heavy metals, there's a load. Chemicals, there's a load. But we all have those. But it's not a serious load. And we have an intact immune system portrayed by this box. And we have a good methylation. Methylation is one of the key cycles in our body that determine detoxification efficiency. As we progress on, we see something very different in the typical autistic child. He doesn't have healthy flora, lack of digestive enzyme. Fungal infections are rampant. We can measure this in the urine by looking at compounds that the fungal give off. There's bacterial overgrowth, there's food allergies, maybe or maybe not parasites. But you see the GI tract is definitely not happy. It's inflamed, and that inflammation is affecting the child. The immune system is not working well. And then we have the things we don't know about. We don't even know what we don't know about. Over here, the heavy metals are higher, and this is because the detoxification system isn't working very well. Methylation is not working, and these are common findings. 90% of autistic children do have problems in their methylation cycle. There's a chemical load. We're all born with chemicals. The Environmental Working Group did a study that found the average child had over 300 chemicals in their cord blood. So you have this inflammatory load coming from the toxic load. You get an inflammatory situation from the gut, and you don't have much help from the immune system, and so you have an autistic child. Well, we have found over the years that autism can be improved, not by treating autism, because we really don't know how to treat autism, but by treating the comorbidity. Treat the child's health problems. Improve immune function. Remove excess bacteria and infections from the gut. Remove heavy metals. Improve nutrition. Get rid of junk food, allergies, improve detoxification, and minimize the effect of genetic SNPs. And we can do this by nutrition. For example, the MTHFR 677 enzyme makes L-methylfolate, which is active folate. And if that enzyme is impaired, all we have to do is supply active folate to negate the effect of that genetic SNP. This slide portrays what happens when we treat the comorbidity of an autistic child. We supply healthy flora, we supply digestive enzyme, we treat the fungal infections. Looks like the bacterial overgrowth is maybe not completely controlled. Food allergies are still bothering us, but overall the GI tract has improved. And while this arrow here is portrayed as green, it might be yellow, but there's less toxin load coming to this child. We go over here and look at the toxic load coming from heavy metals. We've reduced the heavy metals. We've improved detoxification, and we've improved methylation by going around it. And so we've reduced the load. Now our arrow is no longer red, it's now yellow. And we see a lot of the toxins are going out through our detoxification system, as portrayed by this red arrow. Now, nutritional support plays a big role in this because we're providing flora, digestive enzymes, we're providing support to the immune system, we're supplying methylation support and detoxification support, and this is helping the situation. By reducing the comorbidity, where we have a lot of toxic load, we start to see the effect of the autism go down. And this is exactly what happens when you start treating all these cofactors. Now, if you just treat one and ignore some of the others, you may not see improvement. But if you consistently look for all these comorbid factors and start treating them, you'll start to see the autistic characteristics subside, and in many cases, the child will be off the autism spectrum altogether. So a healthy state, or immune capacity, exceeds load. When it's the other way around, then we have illness, and this is not just true for autism, but true for fibromyalgia, cancer, all kinds of chronic illnesses. It's when this principle is violated that we have health problems. So thank you very much. I hope this helps you understand the role of comorbid conditions in autism and what we can do about them.